Good afternoon to those who are from Southeast Asia who are based here in Singapore. Good morning if you are in Africa, Europe, because sometimes we have friends from other continents joining us. Good evening if you're based in North America, Latin America. Welcome to this new edition of our Conversations in Planetary Health. I'm Renzo Ginto, Associate Professor here at the SingHealth Duke-NUS Global Health Institute, which is based at the Duke-NUS Medical School, National University of Singapore. We have a very long name, so please bear with us. And as you know, especially for those who have been joining us for the past 3 episodes already of Conversations in Planetary Health, this seminar is our opportunity to hear new perspectives, exciting projects that really try to tackle some of the pressing challenges that we are facing at the nexus of human health and the health of the planet. And here in SDGHI, this year we actually established a new planetary health initiative, and we really want to incubate projects that will address some of these challenges, of course in Asia but also beyond. And that's why we're really excited to hear again new perspectives, insights from some of the world's experts in this exciting new field of planetary health. Today, we're very privileged to have with us a colleague, a new friend, and hopefully soon a collaborator. We just met actually today, and we were exchanging notes. There's plenty of opportunities for synergy, for convergence. She's joining us from the United States, but she's also not very foreign to Singapore. She is the Samuel and Lislott Herman Professor of Social and Behavioral Sciences at the Yale School of Public Health, but also a Professor of Psychology at Yale University. But previously, she also was the Dean of Faculty of Yale NUS College, which is also part of the National University of Singapore. And of course, if you registered, you've seen her amazing bio. We were just describing that we're just so interested in so many different things. And I think in planetary health, you really cannot avoid looking at, different issues, how they are interconnected, and how can we solve them, right? In a more holistic and integrated way. That is what planetary health is about. But today we're going to focus, although focus is perhaps a difficult term to be focused on, but now she will be talking about urban health. And how can we build the resilience of cities, especially in this day and age of persistent health inequalities, but now, facing the emerging existential threat of climate change. So what will happen is that we'll have a presentation for around 25 to 30 minutes, and then we'll open the floor, both the physical floor and the virtual floor, for Q&A. So please, to our online audience, you can use the chat box for your questions, for your comments. We will read them later during the open forum. So I'm supposed to say welcome to Singapore, but you've been part of Singapore, of the Singapore ecosystem. But welcome to Duke-NUS, Jeannette Ickovics. Thank you for joining us.
Thank you, Renzo.
Let's give her a big round of applause.
Thank you so much. It's great to be here. It's great to be back. I'm actually at Yale NUS this semester as a visiting professor, and I have spent time at Duke-NUS over the years, and it's really nice to be back today. So I am going to start. Okay.
Okay. And maybe we should, I think it's already shared. You need to move the Zoom, right?
Yeah.
And then we'll just ask the audience, to our online participants, can you now see the slides? Please give us, again, a thumbs up just to let us know. Okay. So they can see the slides, and here we can see it also in the room.
Perfect.
Wonderful.
Okay. Well, thank you, Renzo, for the warm welcome. And yes, we have many opportunities for collaboration. And I also want to thank Glenn Coe for introducing us, a former student and now a colleague, and somebody who I know shares great dedication to improving the world's mental health, which certainly needs to be part of our planetary health solutions. So I'm going to start with what in some settings might be a provocative statement, but here I think it really just forms a foundation for what we all know to be true, which is that the climate crisis is a health and equity crisis. And I say that because climate is threatening our food, water, and air. It's worsening disease and extreme weather. And of course, it is putting our physical, mental, and social well-being at risk. There is an urgent and accelerating threat with climate change outpacing predictions and placing immense strain on communities with terrible consequences for health. And as Renzo said, I'm going to be focusing on cities because cities, especially in developing nations that have fragile health infrastructures, face substantial challenges responding, particularly those who are already face various disparities and inequities and lack of access to care in cities or exposure to more toxic environments. They, of course, are more vulnerable also to changes related to climate change. And so amidst these challenges, which of course we've painted a bit of a bleak picture to start, action at the intersection of climate and health offer potential for substantial co-benefits. And I think that this is really important to consider not just the threats and challenges, but also a focus on solutions. And I will share some in the next 25, 30 minutes or so, but I hope that you will as well. So obviously, climate-related events like extreme heat, water scarcity, ironically, we've got water scarcity on the one hand and flooding on the other. Vector-borne diseases have detrimental effects to physical and mental health, as I mentioned already, disproportionately affecting marginalized communities. And I think we often talk about during COVID, but I think we're here with a group of people in the room and virtually who are in public health, in planetary health, and we all realize that the COVID pandemic is not over, and also, of course, there'll be new threats, infectious disease threats that will emerge. But what COVID-19 did during the height of the pandemic is really highlight these interconnected issues. And I think it presented in sharp relief weaknesses in the healthcare system, but also in urban governance and planning. We also know that in cities, existing approaches often function in silos. So we have different departments focusing on sustainability, infrastructure, and health, transportation, energy, food systems, and often they fail to speak with one another. I'll show you some data about that in just a moment. And they fail, therefore, to address the complex interactions, and again, fail to identify effective solutions. So urban centers in low and middle income countries bear the burden of climate and health crises, despite having contributed relatively little to the cause. Now, I'm sitting here in Singapore in Southeast Asia. I don't need to tell you all that Southeast Asia is one of the most vulnerable regions to climate change, facing rising sea levels, heat waves, floods, and droughts, and increasingly intense and unpredictable weather events. The two photographs on the slide, I literally picked up yesterday. The top one is Chiang Mai, Thailand, the beautiful historic city, once capital of Thailand. And you can see the severe flooding there in the capital. You may have also seen photographs of elephants that died in the flooding from various conservation parks. The slide, and that was just 2 weeks ago. The waters have subsided to some degree. The slide below is from Feni, Bangladesh in July. And of course, they too are seeing a great number of floods that have been really impacting entire communities. I selected this slide to hone in on risks for mothers and children being particularly vulnerable, also older adults, migrant workers, and so on, outdoor workers. And then when Renzo and I were speaking this morning, he mentioned that just a couple of days ago, there were typhoons on the eastern coast of the Philippines that has resulted in flooding that they have never seen before. So tragically, we are seeing these intense monsoon seasons in the region, not only gutting bridges and buildings and villages, but displacing millions and killing many individuals. This slide is from the ASEAN Post, and here you can see the individual expectations of climate change impact, and these are the top countries. And not surprisingly, the Philippines is right at the top, followed by Vietnam. India, of course, is in Asia more broadly. We've got Thailand, Malaysia, Indonesia, and Singapore also in the top 10. So more than 60% of nations at greatest risk to climate change and natural disasters, and therefore their consequent health risks, are in Asia and the Pacific. And it's estimated by as early as next year. And frankly, I believe this slide is from 2019. And I think that this is probably a vast underestimate that 300 to 400 million Asian urban dwellers are at risk of flooding, because when we see what's just been happening in not only the last year, but literally in the last few months, I think that the risks are only even more extreme. And just to draw your attention to the bars, the lighter green here is says a great deal of impact, and the darker green is a fair amount of impact. So bringing those together, you can see that greater than 90% of individuals in those countries listed here, particularly on the top part of the slide, are at risk of climate change. Now, again, many of us have known this. To be honest, I've only been doing work in the climate and health intersection space for the last few years, and maybe later I can tell you the story of how I came to enter this important area. But for people like Renzo and probably many of you, for the Resilient Cities Network, my collaborators, you have been doing this work for 10, 15, 20 years, and maybe some longer. And yet it took the COP group, the UN, the UNFCCC, and the communities of practice 28 years to recognize that health is part of climate change. And you can see this slide, this image here is sort of a holding slide that is from the inaugural Health Day and the Climate Health Ministerial, which underscored the need to integrate health concerns into the global climate agenda. It was last year in Dubai that the COP28 UAE Declaration on Climate and Health received 148 government signatories. I checked yesterday, there's 151 now, that signify a global commitment to address climate-related health impacts. And $1 billion commitment was made, including the Green Climate Fund and the Tropical Belt Initiative here in Asia. Having said that, though, it's not clear exactly how that billion will be spent, where, by whom, what the priorities are, and how the money will be dispersed. So it's a good first sign, but clearly it took too long to get there, and we certainly cannot wait another, we really can't wait any more time to get climate and health discussion ongoing. Just one quick aside, I have to say, I was in Dubai, and I was at COP28. It was my first COP meeting. And I had people say to me, wow, really? I never knew health was related to climate change. And of course, being in public health for many decades, with all due respect, I hope it was none of you on this call, but I remember thinking, what rock do you live under that you did not recognize that health and climate are so inextricably tied? This is a framework from the World Health Organization. I'm sure that many or most of you are familiar with, so I won't go, given time, I won't go into a lot of detail, but I will, let me just start at the bottom and work my way up and tell you that climate change has risks on many different health outcomes, and they are imaged at the bottom, ranging from chronic disease and infectious disease, as well as mental health. You can see on the right side that there's also an acknowledgement of the impact of climate and climate threats on health systems. And that, of course, is both health facilities, but I would say also community health. And then working up into the middle, the World Health Organization also recognizes and articulates a set of vulnerabilities, both in terms of population health, exposure pathways, and once again, recognizing the importance of health systems. Now, I took this a little bit upside down or bottom up because I wanted to end this slide talking about vulnerabilities and switch to talking about resilience factors. I'll spend a few minutes talking about resilience, urban resilience, and then spend the rest of my time talking, sharing with you results from a global survey of nearly 200 city leaders. But just a quick moment on urban resilience. Urban resilience is the capacity of individuals, communities, institutions, businesses, and systems to survive, adapt, and thrive despite acute shocks and chronic stressors. Now, I am actually a social and health psychologist by training, and I wrote my first paper on resilience, I think it was in 1989, thinking more about psychological resilience, as Jean Liu and others think about. And it was really a few years ago when I joined forces with Resilient Cities Network, a global network of 100 cities around the world, but headquartered here in Singapore, that I began to apply these principles and ideas to a broader framework. So just quickly, acute shocks, of course, many of the climate shocks that we've already been talking about, but also, as I've listed here toward the bottom, issues like civil unrest and terrorist events can also be considered acute shocks. Big accidents that may be climate or otherwise infrastructure related. Chronic stressors, again, can be tied to climate, things like environmental degradation and sea level rise, persistent drought, but also rapid population growth, food insecurity, issues related to homelessness, aging infrastructure, poor governance, and systemic inequities. And so, again, you can see that we all are faced with acute shocks and chronic stressors that impact our health, impact our mental health. And of course, climate accelerates these associations and accelerates the risk. Now, just a couple more slides on resilience before turning to our city survey. I think it's the academic in me that just is providing one slide, at least, on the theoretical underpinnings. And these come from my own discipline in psychology on the bottom right, such as adaptation in the face of adversity, trauma, tragedy, and so forth. And despite this, we still, when we are resilient, can recover and even thrive. A bit broader, we see underpinnings from sociology, the capacity to learn from experience and incorporate learnings into interaction with social and physical environments. Ecology, again, a bit broader still, absorbing disturbance and maintaining function, the capacity of systems to self-organize. And then interestingly, and you can see by the note here, I adapted this slide from Lorien Farrell, who is the former North America Director for Resilient Cities Network, who herself was a structural engineer. And so structural engineering is here as one of the cornerstones of resilience, in this case, thinking about returning to steady state after perhaps a physical perturbation and sustaining required operations. The last slide is to bring forward the city resilience framework. This is version 1. Version 2 is about to be released, but it's quite similar. It's a bit more detailed. Here you can see that there are 12 drivers that collectively determine a city's ability to withstand a range of shocks and stressors. And a quarter of these, so we've got them in health and well-being related to meeting basic needs, supporting livelihoods and employment, and then also, sorry, it's small print on my screen here, also ensuring public health services. We also see that there are drivers in the context of economy and society, infrastructure and environment, and leadership and strategy. I'm happy to come back to this a bit later. But it's in this context, all of this brought together, that we launched Urban Pulse. So Urban Pulse is a collaboration. It's the name for a project that is a collaboration between Yale University and Resilient Cities Network. And it is based on things that I've really just talked about over the last 20 minutes or so, that cities are on the front line, not only as threats, but to protect communities from the effects of climate crises. And that we believe that solutions that promote health, equity, and climate resilience have the power to save lives and livelihoods of millions. And as such, we've been bringing together cities and urban and health practitioners to help expedite this action. Cities matter because most of us live in cities. About 55% of global populations live in cities. I know it says 50%, but it's now 55%, with an expected rise to 70% by 2050. If we look at low and middle income countries, it's already higher. It's about 85, can be as high as 85%, and growing faster in Asia and in Africa, especially city population urbanization. Cities produce the majority of global emissions and often face the most severe health and climate impacts. I mentioned earlier, those in concentrated poverty and without access are disproportionately vulnerable. And city governance is often siloed. And so if we take this all collectively and hone in on the last bullet in bold, cities are at the epicenter of interrelated health, climate, and equity challenges, and action in cities offer potential for substantial co-benefits and a certain level of efficiency. If most of us are living in cities, if most of the emissions are coming from cities, it's a really important place to target. I won't go through the image on the right, the exposure pathways, but it's just another way of saying what I did and providing this for those of you who are a bit more visual thinkers or learners. So let me turn now to the final piece of this talk before we open it up. And that is the results of a report we call the Urban Pulse Report. This was released last month at the UN General Assembly and Climate Week New York City, and will have its global premiere at COP29 with the World Health Organization. We contributed results from this survey. Some of what you'll see here were contributed to a WHO report, particularly with a focus on the cities chapter. So the map here shows the respondents, as you can see, from all over the world. We had about 200 city leaders from both government and civil society from 118 cities and 52 countries. I'm not going to go into a huge amount of detail methodologically, but again, something we can come back to. But I will say, for the wonky people in the room like me, what you'll see when I talk about percentages in terms of response is a weighted sample. so that every city got sort of one vote. So when I say 2/3 of cities, it's 2/3 of 118 cities. So if there was more than one respondent from a particular city, we averaged their responses so that each city, one vote, if you will. And in addition to the surveys, we did qualitative analysis of open-ended questions, plus 8 stakeholder interviews in Africa, Asia, and Latin America. And we don't have a lot of time, but I'm going to present a little bit from each of these 3 approaches. So the first, coming from the city surveys, and I did make sort of a hard decision to present some general findings. I will say, and I mentioned to Renzo earlier, that one of the frameworks, a big backbone of this survey work, was actually the Lancet Countdown on Health and Climate. We used their indicators as a framework for the survey. And from there, we also added some additional questions about data infrastructure, about health systems, about priorities, and about solutions. But at a very high level, in terms of city readiness, as you'll see in a moment when I provide the next slide with a bit more detail, quantitative detail, 2 out of 3 cities recognize climate threats to population health. However, they're inadequately prepared, they have deficient municipal systems, and lack of multi-sectoral collaboration. They recognize, that is, city leaders recognize the importance of vulnerable populations. They also suggest that if they had an opportunity to create a zero carbon economy, that their population, their city, and the people in the city would benefit. And they are ramping up engagement at the city level, but recognize that much more is needed. So just to dig down a bit, as I said, cities do recognize the severe climate threats. And it is 2 out of 3. And I say 2 out of 3 loosely because depending on the threat, there's slightly different responses. But at least 2 out of 3 cities recognize each of these: extreme heat, flooding, air pollution, as key climate drivers. When I say that the cities are not prepared, one of the questions we asked is, on a scale of 0 to 100%, how ready is your city to respond to the health threats of climate? And they answered, on average, about 40% ready. 60% have a climate resilience plan for their city, but only 23%, fewer than 1 in 4, have a climate resilience plan that integrates and that explicitly integrates climate and health. So I think I'd love to come back to this issue because I think this is a huge opportunity. It's a huge gap, but it's a huge opportunity for places like your center and all of us working in this area. City leaders do recognize vulnerable populations, such as those listed here. When forced, a forced question, if you had to pick one vulnerable population, who are you most worried about? The majority of cities said children. So we can think about this, right? The flip of the gap, the challenge, and the opportunity. Nearly all respondents, about 88%, said transitioning to a zero carbon economy would create economic opportunities. And as I said, political and community engagement at the nexus of climate, health, and equity would provide an opportunity to identify, implement, and amplify solutions. So turning again, just briefly to a thematic analysis, we had more than 300 responses to questions to the cities of what are your climate and health solutions? Where are you working right now to address these issues? And in order, the number 1 area that cities were working in are greening initiatives. So these are things like major tree planting initiatives. Freetown, Sierra Leone, for example, has a big campaign called Freetown, the Tree Town, and they are planting 1 million trees for shade and for carbon capture. Karachi, Pakistan is another city, a city here in Asia that has planted 500,000 trees. What's interesting about the Karachi example, and I was on a panel with the mayor of Karachi in Dubai, is that the city, of course, with outside funding, has planted those trees, but they have really mobilized the local community to take care of those trees, to sustain those trees. And I think one of the important numbers there is that not only were 500,000 trees planted, but more than 80% of those trees have survived. And that is with community engagement and care and sustainability. Beyond greening initiatives, there are health-related interventions. I'll tell you more about those in a moment, but things like dengue control and vaccination. There's a very, very, very big issue with data infrastructure, particularly related to disaster management, the lack of meteorologic services for early warning and rapid response. We also have city systems, things that were raised, waste and water, transportation, heat, food systems, and energy systems. So just to give you an example, and I will share the report with you in a moment so you can see a lot more detail. The last area I'll just mention is that I said that we did 8 deep stakeholder interviews in 8 cities across Africa, Asia, and Latin America. Here, in terms of a bit of a synthesis, across these cities, they recognize the challenges related to city capacity, neglected vulnerable groups, a misalignment between needs and policies, inequitable resource distribution, and a reliance on short-term fixes, sadly, a result of our political system where people are always thinking about the next election. But nonetheless, they also recognize opportunities to enhance infrastructure, promote inclusive policies, empower communities, and raised up the issue of accountability through transparent engagement. So to give you 2 examples from the region, and these are 2 cities that have been very involved they are Resilient Cities Network cities. They've been very involved. And I got to meet leaders from Semarang and Surat in Mexico City in May when we had a city exchange. And here you can see a bit more detail. Obviously, it's still quite high level, but some of the things that are happening as solutions, identified as solutions, integrated health monitoring, data-driven interventions like mapping vulnerabilities and public education, equity-focused adaptations, and vector-borne disease management in Semarang. Likewise, in Surat, vector-borne disease management is considered really high priority. For those of you who are perhaps joining us or watching this later across Latin America, of course, this is a very high priority for you as well. Surat also has been very actively focused on climate adaptation and mitigation, and they have put together a big center on health and climate resilience that is really dug deep in terms of heat vulnerability assessment, action planning, advocacy, and action models. So as I come to a close and get ready to open up to all of you, I will say that in our report from Urban Pulse that was released last month, we have a series of recommendations for cities that can be kind of characterized in these 3 big buckets: prioritizing health in city-level climate action, redirecting resources for resilient systems, and fostering collaborative and data-driven approaches. So I think really, if I had to say one, partly because I like the word play on it, is putting health at the heart of urban climate health agenda, of the urban climate health agenda. If we put health at the core, at the heart, then I think that can really either provide an underpinning, a strong foundation for the rest of what we do, or also can be a lead driver. And then, of course, we do need to address adaptation and mitigation. We need to address healthcare system. We need to address economics, the financial flows, and cities. And I recognize, of course, the importance of data infrastructure, political engagement, city-to-city collaborations, and we need to build on successes, evidence-based and evidence-informed action. Now, we can't do any of this without money. So in the report, we also have 3 strong recommendations for funders with regard to dedicated funding for new and sustained initiatives. First and foremost, we just need to acknowledge that we have to prioritize funding and increase investments in projects that integrate climate, health, and equity, and develop new financing models. Secondly, supporting capacity development, like technical assistance, feasibility studies, and equipping city officials with knowledge and skills. And I bet you are doing things like that here at the Duke-NUS Global Institute on Global Health. And we need to fund research and evaluation. As a researcher myself, I think it's really important to not, while we are certainly on the ground doing programs, projects, policies, we certainly need to continue to assure that we've got evidence to support the interventions, to scale them up, and to think about cost benefit. So as I say, by putting health at the heart of climate action, cities can ensure a healthier, more equitable, and resilient future for all. I have just 2 more slides I'll flash up, and then I'll come back to this so that you can click on the QR code. I tested it yesterday. It should work for you to get to the full report. I'll come back to this in just one moment. So I'll sort of close by saying that we need to take action now. We have the resources, we have the technology, we have the evidence to cultivate communities where every person enjoys good health, well-being, and shared prosperity without harming our planet. Fundamental, foundational element of planetary health. And I say we, in this case, cities are on the front line already implementing solutions to create a better future. And the work that we do has co-benefits for climate and health. And so if we think about, wherever you're sitting in the world right now, certainly here in Singapore and elsewhere in the world, we can be a model for other cities. That is the learning, the peer-to-peer networks. And I will just close by thanking really so many of my collaborators at Resilient Cities Network, particularly Lauren Sorkin, the executive director, and Carl Asbury and Malcolm Campbell, the 2 people I work most closely on the health work, but also many others at Resilient Cities Network, as well as the city leaders who are part of our engagement, and the nearly 200 of you who responded to the survey. Also, colleagues at Yale University in Public Health, School of the Environment, Medicine, and Nursing, as well as the Yale Center for Climate Change and Health, and the Yale Institute for Global Health, and Yale Planetary Solutions. And finally, thanks to the Rockefeller Foundation, who provided the first year of funding for Urban Pulse. So I will stop there, but as promised, I'll put this back for those of you who want to use the QR code to explore the full report. And I am pleased to stop there and open it up, hopefully not just for questions, but also for broader discussion. Thank you so much.
Thank you so much, Jeannette. Let's give her a big hand. And I really appreciate that you ended with that slide on action now, because especially when we're talking about persistent health inequalities and now the emerging threat of climate change. We always say, and I always describe SDGHI as a house filled with pracademics. We're practitioners and academics. We do research, we mentor the next gen, but we make sure that the knowledge generated by academia is being utilized immediately, by practitioners, by policymakers. We work with governments, we work with the private sector. I think we will need to work more with cities. And I think this discussion is very timely as well, because right now in our Planetary Health program, we're incubating some projects on climate and health here in Asia. And we're starting to realize that maybe the right unit of analysis and action is a city, right? Sometimes national governments are more challenging to deal with. There's bureaucracy, there's the national politics, there's the international politics. I even wrote here that nations are divided by borders, sometimes even with physical walls, like in your part of the world, in some parts of the country. But cities are very interconnected, right? Through the airports, through transport, through trade, and even digitally. And so, there's one question that was even percolating in the discourse. Should we now be leaving global governance to the mayors and give it to the hands of the mayors, because national governments, heads of states, are too slow to act, right? Because again of the politics, because of the many different interests. So maybe that's something we can think about, and maybe have some insights based on the research. Is this the way to go, right? If we're going to address health inequalities and climate change and many other problems, including future pandemics, but using the city really as the vehicle for action, right? And then I also appreciate, and I'll open, while I'm giving some reaction, hopefully our friends in the room are preparing also their questions or their comments. We also have a few questions in Zoom. When you talked about resilience, in fact, I have a chapter also on resilience in my doctoral dissertation, interrogating the use of this word, right? Because everybody's now using resilience. It's a new buzzword, right?
Not so new, but yes.
Not so new, exactly. But especially in this past 5 years, thanks to COVID, everybody's talking about pandemic resilience, climate resilience, of course. When you show the concentric circles of city resilience, WHO has a concentric circle framework for climate resilient health systems, right?
Yeah.
So now everybody's talking about resilience, but I think there's still very limited understanding of what it truly means and how to operationalize it, right? I remember one of the ways I usually laymanize resilience, like the bamboo that we have a lot of here in Southeast Asia, it bends without breaking, right? Some will use the metaphor of the rubber band, or many other, at least images that show the continuity and the sustainability of the integrity of the system, even in the face of, as you mentioned, shocks and stresses. And actually, my question, based on the survey, I think when we talk about resilience, oftentimes the first things that come to mind are the acute shocks, right? We need to be resilient to them. But we always forget there are chronic problems that countries, and especially cities, do face: chronic poverty, pollution, both explicit and invisible. Are you seeing some distinction between resilience measures for the chronic shock, for the chronic stresses, versus resilience measures for the abrupt shocks? Or are there measures at the nexus, right? Things that we need to invest in and implement because they are good to safeguard, to protect us against the abrupt and catastrophic on one hand, and the chronic and the long term and the persistent on the other. So those are just some of my initial comments, thoughts, part question. And I don't know if you want to react to some of these thoughts right now, but please signal to me if you want to jump into the discussion, and then I'll also read one or two questions from the
audience. Let me respond to a couple things. I'm not sure which one to start with. All right, I'll start with resilience and then go back to cities. When you started to talk, Renzo, and the people sitting next to me can validate, I thought you were gonna bash resilience a bit, and I wrote resilience, resistance. So there are some people who don't like the term resilience, for any number of reasons, but also that there's a certain, maybe, I don't agree fully, I actually like the term, but I think this issue of whether it's a passive response to these external events and versus resistance, being more active and thinking about empowerment, and then also a much more, what's the word, vigorous response to threats, be they from the inside or from the outside. And a metaphor that I often use you use bamboo, which is perfect for this part of the world. I think a spider web is another one. A spider web has these threads that appear, rather fragile, and, blow in the wind. But when they are hit with a force, to really be concrete with the metaphor, a bug that hits the spider trap, the tendrils get rigid. And when the alternative, the other piece of that is that when there's a break in the spider web, its design is both resilient and resistant to further breakage because of the many types of the many connectivity, the multiple points of connectivity. And so there's a flexibility, but also a resistant response. And the spider web, ounce for ounce, is stronger than steel, according to a biochemist from MIT, whose name I'm forgetting at the moment. And I think in some ways that gets me back to cities. So I don't think that national governments will cede control to the cities. So I love your point of cities being connected by transport, by digital connections. Also, because they are smaller units, they are more, they are more nimble. And that's that link between resilience and those qualities of resilience and cities. Cities are smaller, they can be more nimble, they can be more flexible, they can respond more agilely, with greater agility, more quickly. Having said that, they're still mired by politics, by local politics. And I will say that I deeply value the work in cities. I'm dedicated to continuing the work in cities and the collaboration with the Resilient Cities Network, but it too has challenges because of the ability to respond, the competing priorities, the lack of resources. It's hard enough sometimes to have an impact, let's say at the individual level or family level or neighborhood level. The city level can be complex with differences in resources, hygiene coefficients, not only across nations, but within cities. And so difference between the rich and poor, access to health and so forth. So it's all complex. We need to pick a unit of analysis. I think cities, as I said, are an effective, efficient place to start, not without its challenges, but a good place to mobilize, and one I think we need to continue to continue to act from.
Yeah. I appreciate your last comment about the politics even within cities. I'm actually reminded elections are coming in the Philippines, my home country, and there are certain cities where the contenders for the mayoral position are the brother and the sister, right?
Yes,
So
sir.
and that happens, of course, not only in the Philippines but also in many cities across the world, especially in developing countries, right? Or maybe even in a place like the US, you have those interesting political.
I'm going to say two things. Election day is my birthday. November
Oh my God,
5th.
your elections is coming sooner.
I am hoping and praying for a good outcome.
Yep, we're recorded, by the way.
There's only one answer. If you are in favor of climate and health and equity and planetary solutions, then I'm going to go on a limb and say I hope and expect that you will vote for Kamala Harris and Tim Walz, because if we care about health and climate and equity, that's the only alternative we have.
Yep. Wonderful. And we really cannot avoid the politics when we talk about climate, health, equity, urbanization. Any other comments from the room before I read one or two questions from the online audience?
I have a brief question for the pulse survey, which is very interesting. So it's the first one. And how often is this going to be done? And is the plan to have more cities? Because the Resilient Cities Network has can't remember how many.
About 100, yeah.
About 100. How about to bring in more on board? I love the point that you made that it would serve as an example for more cities. But is there, could there be a feeling of those that are in and those that are out? Or how is that working?
Yeah, thank you, Stephanie. I'll respond quickly so we have time to get to the online questions too. One is that we did offer the opportunity to contribute to the survey through certainly Resilient Cities Network, where we gave a big push. There are about 100 cities in the network. There are 100 cities in the network, but we also went through ICLEI and C40 and a Climate X Health network. So we did push it out more broadly. The respondents were not limited to our cities, as we say. Right now, we do not have additional funding for a follow-up survey, but I think it would be fantastic. Rockefeller Foundation funded this first one. So if there are any funders on the call, or if it's something that we would want to think about working together on, I think it would be very important to think about follow-ups to identify advancements, and then also some places where there's retractions. When we see these bigger, these huge, the monsoon season here right now in Asia, and these huge impacts, and we have concerns about infrastructure right now, what happens when that infrastructure is wiped out, for example, by this, really profound flooding? So I think the replication would be really critical, and I'd love to, would love to talk more about that.
Yeah.
There's probably more to say, but we can talk about that.
In fact, you're giving us an idea, because so right now, one of the upcoming projects that we're incubating is the establishment of an Asian Climate and Health Observatory.
Yes.
And we want to monitor, a wide range of variables.
Yes,
and I think an important component is to monitor cities, how they're progressing when it comes to, addressing climate change, but also ensuring that they protect people's health and reduce health inequalities at the urban level.
100%. And I will say the other thing I was thinking was that one thing you saw, if you look at that map, was we really actually had an over-representation from the global south, from Asia and Africa. And I think in terms of an Asia or Asia Pacific center, as you're talking about, and an observatory and potentially focusing on cities would be critical. I think the reason we had so much interest from UN and the COP29, excuse me, and WHO is because it was the first survey that really had such a big voice from across Asia, Pacific, Africa, more so than just developing cities in developed nations.
Indeed. And since you mentioned COP, there's actually a question from Shang Rentan regarding COPs. We were both in Dubai. We didn't get to see each other because there are 80,000 people in that circus, right? Unfortunately, I'm not going to Azerbaijan in November. But the question is COP still the right platform? In a way, it echoes my earlier comment about should we be giving mayors a greater say in how to even, in a way, govern the planet, right? And is COP still the right platform? Because, actions taken by the biggest countries that contributed the most, the greatest amount of pollutants are not fast enough, right? It's all promises, as we've seen, in Dubai. We'll see it again in Azerbaijan. And the small countries, and maybe even the smaller, less resource cities, are the ones really bearing the brunt.
Yeah, I mean, it's a complicated question. As I said, I'm new to the climate and health space and brand new to COP. Thank you. And brand new to COP. It's probably one of the most challenging things for those of you who don't know the system. And as I just learned myself, one of the things with COP is it requires full agreement. It is not a majority agreement. It's not, but it also means that all nations do have equal say. So that means even the small island nations have the same 3 minutes that a place like the Philippines or the United States has on the platform, on the UN platform. So it's certainly a very important platform, but it is not the most nimble platform by any means. And it does result in a bit of a regression to the mean because of the requirement for unanimity in order for a statement to come forward. So I think those are two of the biggest concerns. And I think it's an and both answer.
Mm.
We need recognition at the highest level, and we need that financial commitment, the $1 billion commitment, but it needs to be acted on the ground, and we need to be operating at multiple levels, at the multinational level, national, city, local level concurrently.
Brilliant. And two short questions. I'll read them both and feel free to answer both or just one of them. One is about population, because cities, as you mentioned already, 55% of the world population live in cities. They keep on growing. What should we be saying about population growth as a driver of both climate change, but also, the many health challenges that we face? And then apart from the population growing, trees are also growing. There's a question about tree planting. You mentioned one of the most common interventions is these greening initiatives, right? And what's the evidence when it comes to these efforts done by cities? Are they just greenwashing, right? Planting some trees and give it the mirage, right, of us doing something for the climate when we're increasing housing, we're building more buildings, and that means cutting more trees as well.
You people are smart. Very good questions. I'll again take them in reverse order and say that, I think tree planting is important for at least two reasons I mentioned, which is carbon capture and shade. And in an increasingly hot planet, we had the hottest days of the year and the hottest days of all time and the hottest months of all time just in this year. Having said that, we need to be thinking about mitigation. Of course, mitigation needs to be critical, not only adaptation to climate change, but mitigation. And that means, from a public health perspective, thinking about more primary prevention and even coming back to COP for a moment, the issue of, the elimination of greenhouse gases. All the trees in the world aren't going to enable us to reach our goals if we don't reduce carbon emissions and greenhouse gas that are already coming out. So I don't think it's greenwashing, but it's one solution that cities can undertake. It can improve the quality of life, health and mental health of residents, but it certainly needs to be part of a much bigger plan. And lastly, population growth, certainly 8 billion and growing is very challenging. I think it creates, again, these potential threats. And maybe what these two last questions have in common is an issue that will bring us right back to planetary health. Yeah. And that is, I think that when we think about adaptation, mitigation, the use of trees, the use of other solutions as well, in the context of population growth for the planet and within cities itself, the first word that came to my mind is biodiversity. And I think that in these ways, we really need to, in order to support the best health for the planet and the people, we need to support biodiversity. And I think by addressing growth of cities, growth of population, and our natural as well as built environments, it gives us the greatest chance to focus on biodiversity, to focus on planetary health, and ultimately to support and sustain health of all people.
Wow, we covered so many topics, and I think we barely scratched the surface. We can keep on and on, right? When you said the term biodiversity, I was just reminded of what's happening now in Indonesia. They're moving the capital from Jakarta to Nusantara, which means they're going to cut more trees, they're going to destroy more ecosystems. And you just begin to wonder, has there been a very comprehensive environmental and health impact assessment done, right? In making those.
Nusantara on Borneo.
Yep,
of all places.
Maybe that's our next project. But I'm sure this is just the beginning of many collaborations and synergies for advancing planetary health. So, wow, this has been a very rich conversation. I would just like to thank our colleagues who joined online, but also those who are in the room. And I'm sure we are all coming out of the room with lots of exciting ideas and hopefully inspiration. And of course, thank you, Jeannette, for the time, for sharing your wisdom. And again, this is just the start of many. Thank you again. And to the audience, join us in the next episode of Conversations in Planetary Health. Thank you and have a good day.